You, Dr. Rosenfeld.
Thank you. Nice to be
Glad
here
you
again.
made it in with all this wicked weather,
Yes,
but you always do.
I was ready to broadcast from the car again, but
we like it better when you're here.
Thank you.
Let me ask you about this. Christmas time is coming up, and even if you know that the toys under your tree don't contain lead, there's still a danger of lead lurking, Dr. Rosenfeld says. We have to worry about the decorations?
The bulbs. The light bulbs and the wiring from the light bulbs have been found to contain lead. And it's a very small amount of lead, and the lead is necessary because it's fire retardant and it prevents the cracking and so on. So it's a necessary thing. But my advice is this: put those bulbs high up where kids can't reach them. Even though they have only a very little bit of lead, when a child plays with the bulbs and the wires, then puts the hands to the mouth, you get a small amount of lead. It's unnecessary. Adults, I think, should wear gloves when they're using these bulbs, and children should not have anything to do with them.
So the ornaments, though, you don't know where they're made. Some of them might be made in China. Is there a risk as well?
I don't know. I haven't heard about the ornaments, but I tell you something. There is a way for a parent to tell whether a toy or an object has lead. There are 3 or 4 products on the market where you take a swab and you wipe it on the item in question, and it turns black after a few seconds or minutes. Now, Consumers Union recommends this. Some other people say it's not necessary. I think with all the question about toys and stuff and the lead they contain, if you can get one of these devices and test for it, and you have small children, I suggest you do it.
Maybe that's a good Christmas gift. What about the tree itself? If kids go and they grab some of the branches off the tree and they put it in their mouth, do you have to worry about that? Well,
it depends on the kid. I mean, and my kids don't. My kids never. They're very well behaved. They knew what to grab.
Right.
They knew what to eat. But the other thing is, make sure nobody gets any mistletoe, because sometimes the berries and the mistletoe itself can give severe gastric irritation.
All right, make a ham instead. That's what I say. Steroids are in the news this week. They're very much in the news, as you know, with the Major League Baseball scandal. And so the question that we had for you, Dr. Rosenfeld, is if you're taking steroids for medical reasons, perhaps for an anti-inflammatory purpose or another ailment, do you need to worry?
Look, let me clear something up here. There are steroids and there are steroids. All the news has been about what we call anabolic steroids. These are testosterone-like substances. They're artificial, and they've been allegedly used by sports figures in order to build up muscle and muscle strength. The other kind of steroids that doctors prescribe for many patients have nothing to do with anabolic steroids. The word steroids is inappropriate for both these things. The steroids that you're given for asthma, for rheumatoid arthritis, for severe inflammatory conditions, to stimulate the immune system so that you don't reject, those steroids are corticosteroids and have nothing to do with anabolic steroids that sports figures are taking. As far as the sports figures using these, I think it's sad. I think it's sad that the American people demand such performance, because this is now big business with millions of dollars in salaries. So these fellows are motivated to build their muscles and their strength. How much additional strength they get from it is problematical. I do know that continued use of these anabolic steroids can cause trouble with the liver, with the kidney, with some kinds of cancer. So I don't recommend it at all. What worries me is that so many of our younger kids who want to be athletes, and this includes girls, are using these steroids, these anabolic steroids, surreptitiously, and they are not without danger for them. So if you're a parent and you notice that your son or daughter has suddenly become very muscular, look into it.
All right, and this week is a good reminder to just talk to your kid about it as well. So, Doc, this is the holiday and party season, and of course you may not be eating as well as you might be able to the rest of the year. Are there any foods that are safe to eat this time of year that we might enjoy as much as the fattening stuff?
Well, you know, it's largely a matter of quantity. But if there are some foods that are good for you, that are healthy for you. I prepared a There it is. The good holiday foods. If you're going to eat meat, and meat is good for you, it contains protein, make sure that the meat you buy is extra lean meat. If you're going to have chicken, skin the chicken before you eat it. If you prepare lunch meals, make sure they don't contain a lot of fat. Now, they are the things to avoid in the foods you eat are fatty meats, visible fat on meat, fried meats, and all the seasonings that that are put on them.
And the alcohol.
And well, that doesn't come under meats.
All right. Well, we have much more ahead with Dr. Rosenfeld loves to get your questions, and this one's from Claudia. She writes, I have carpal tunnel in both hands. Surgery was recommended, but she's heard so many success stories. Well, she tried the splints. They didn't help, and she's wondering, doctor, if there's any new treatment she should consider.
That's a very interesting question, very important question. First of all, let me tell our viewers what carpal tunnel is. In the wrist, there is a tunnel through which an important nerve passes. That's the median nerve. It's by the thumb and the forefinger and the side of the middle finger. Now, when that nerve is pressed upon, when the carpal tunnel itself is swollen with edema, irritated, that nerve is pressed upon, and that causes pain, numbness in the wrist, sometimes in the upper arm, and the hand, weakness. And we see this very often in people in industry using repetitive movements of their hands. Now, surgery should be a last resort. There are many ways to treat this carpal tunnel medically. First of all, it's common in diabetics. It's sometimes seen in pregnant women. It's seen in people with arthritis. And there are medications, anti-inflammatory drugs that reduce the swelling in the tissues surrounding the tunnel. So all of those should be used. Diuretics sometimes to get rid of excess fluid. Exercises, the splints that you used. See a physiatrist who can tell you what kind of exercises to do to relieve the pressure on it. Now, if all these things fail, and also a period of rest, you rest your wrist for a couple of weeks, you should not have surgery and for at least 6 months, during which time you've tried all these non-surgical approaches.
That's great information, and so many people have that, especially with the computer now. Dr. Rosenfeld, thanks. Trying to figure out if we had picked this question because I have 4-inch heels on today. You know, women will go to great lengths and heel heights to wear a great pair of shoes, but kids don't often get to choose what they wear, and some of these young girls are even wearing these high heels. So parents beware. Proper shoes in the right size are developmentally important to your kids. And even if you're an adult, I guess, Dr. Rosenfeld, we should choose carefully. I like them.
Yeah. Well, I'm not talking about heels today. I'm talking about shoe size. Talk about heels next week.
All right.
It's very important for you to wear the right size shoe, especially if you're diabetic. Now, I'll bet you didn't know that a size 10 from one maker may be 10.5 or even 11 from another. There's no standardized shoe size. So when you go to buy a shoe, select it on the basis of how it fits. Now, this is especially important for diabetics. Many diabetics have a problem of losing sensation in their feet because of peripheral neuropathy. They cannot tell whether a shoe is too tight or too loose. They can rub, their feet are rubbed, they form calluses, they form ulcers, and this is one of the important causes that leads to amputation in diabetics with wrong shoe size. So that's very important for adult diabetics. Now, as far as kids are concerned, you know, kids don't wear shoes until they start to walk. That's what, 12, 13, 14, 15 months. When you select a shoe for your child, you're better off with a sneaker-type shoe to begin with. Now, make sure that that sneaker has enough room for the child to wiggle his or her toes. Also, make sure that it's wide enough, because these kids grow very quickly. And if you find that your child keeps taking the shoe off. Examine his or her foot for evidence of calluses, irritation, and so on, and check the size. For diabetics and children, it's extremely important. And don't go by size, because sizes vary.
That's a great tip, Doctor. And